So we are pleased to welcome you to our channel OrthoTV, sir. So let me introduce to our speaker today. We are pleased to welcome Dr. Hrishikesh K. Joshi, Professor and PhD scholar at Parul Institute of Physiotherapy and Research, with a Master's in Neurological Physiotherapy from RGUHS, Bangalore. Dr. Joshi brings over a decade of academic and clinical experience. He is a published author, research guide, and has been a speaker at various national and international platforms, known for his experiences in neurological approaches and motor control. Dr. Joshi continues to inspire students and professionals throughout their insight sessions. So we are honored to have you, sir, today, and we will be carrying forward your knowledgeable speech today. So we just move to you. So just kindly continue your session. Thank you.
Yes, ma'am. Thank you for the wonderful introduction, ma'am, Bhumika madam. And I would like to even thank Principal and Sanchiti Institute of Physiotherapy, Pune, for giving me this opportunity. I am glad that I got this platform, and I hope I will be able to share the best of my knowledge. And the topic today, what I'm going to share is on neuroplasticity. I'm going to share my screen. Today's session is on neuroplasticity. So as I mentioned in my title, it's about the rewiring of the brain. This is a topic in these years of experience less talked about. So I just thought to share my views and my studies, what I've done. I have referred even a lot number of articles. I just thought to speak on this. Of course, it's a topic of my interest. So I told Bhumika ma'am, please allow me to conduct this session. So thanks again for that. Right, so rewiring the brain and harnessing neuroplasticity in physiotherapy. All right, myself, Dr. Hrishikesh, I'm a PhD scholar and I'm a professor in Parul Institute of Physiotherapy and Research, Parul University, Vadodara, Gujarat. So I'll quickly go to my objectives of today's session. I'll introduce you about neuroplasticity. What is that? What is the concept of neuroplasticity? I'll take you to a bit of the history of neuroplasticity. As maximum, people think that it's a new term, but it's not a new term. Types of neuroplasticity. What are the types? And neurobiological basis of neuroplasticity. I'll give you a bit idea about what are the cellular changes or the neuronal changes, to be specific, what are happening in the brain. And yes, of course, ultimately, I'll connect you to the physiotherapy aspects and the physiotherapist perspective and how this helps us in patients' recovery. So moving on to my first slide, that is the concept. So when I say neuroplasticity, so since it is related to the word neuro, it's about the nervous system. Plasticity, when I say plastic, something which can mold, something which can modify itself. So even the brain is a structure. It has been proven, the research has very well proved that the brain has the ability to modify its structure and even modify its function whenever needed. All right, so I have kept a photo. It has got various names written: experience-driven changes, memory formation, learning changes, therapeutic potential, which we achieve in the patient, developmental flexibility, injury recovery. That's where we come, injury recovery. All right, so these are the various phases of neuroplasticity. So to the basics, if I come, let me explain you more precisely. So it is one of the very important discoveries in neuroscience. It can be understood as brain's ability to change, remodel, and reorganize. See, these three terms are different. Brain's ability, it's the ability of the brain. It's a natural capacity of the brain to change, to remodel, and reorganize. We know that millions and trillions of neurons are there in the brain, in the nervous system. But mind well, they can even reorganize, they can even remodel themselves, they can change their structure based on the requirement, and they can adapt to the new situations. So the fact that neural networks are not fixed but occurring and disappearing dynamically throughout our whole life depending on experiences. So whatever we are doing every day we wake up, we do a lot of tasks. But we always say, every day we learn something, every day we grow. So when I say grow, since I'm talking about neuroplasticity, our brain grows, our brain rewires. All right. So we are able to adapt easily. Okay. 1 month back, I was not able to do some task. But if I do it on a daily basis, I am able to learn it. How? I am able to do that task. How? It's because of the brain's nature to adapt, to rewire, to model, to remodel, to reorganize. All right. So that is the meaning of neuroplasticity. All right. While we repeatedly do any task, we practice. We practice sequence of movements, or maybe any mathematical problem, or any task we do in our daily life. The brain, we know that's a mesh of network neurons. It's a neuronal circuits which are interconnected. All right, they are ultimately firing up as we do any task. Even when I'm talking now, you are listening to me. Now your brain is active, your neurons are firing, the circuits are passing the impulses to each other. All right. So whenever we do that practice, the network is totally activated. So the same thing, the advantage is I will be connecting with you at the end of the session when I talk about the physiotherapy things. So currently I'm trying to make you understand what is neuroplasticity. Now what happens once we stop practicing a certain activity, the brain also has the ability to lose the function. So that's what we call it as you lose it or you use it. You call it as use it or lose it principle. It's a principle of neuroplasticity. You use it or you lose it. So if I don't do a task, if I don't practice it, if I don't do a movement when I talk about physiotherapy, you tend to forget that movement and you forget the movement patterns. Your brain tends to forget that pattern of movement and any task what you have learned earlier. So that is known as use it or lose it principle. It's very important to remember. All right. So that is the base, the basic principle of key principle of neuroplasticity. Moral of the story is keep practicing, keep doing movements, and that's what we encourage to the patients. All right. Going to the history of neuroplasticity. So almost about 120 years ago, William James, he was the first person to suggest the theory of neuroplasticity. He suggested that brain is capable of continuous functional changes. All right. So as I said in my introductory talk, that we think that neuroplasticity is a new term. Neuroplasticity is not a new term. Even 120 years ago, this term was coined and was explained and assumed that their brain has a capacity to change its structure and as well as the function. Even Jerzy Konorski, he was a Polish neuroscientist. He first defined the term neuroplasticity in 1948. Donald Hebb, he was a Canadian psychologist. He established Hebb's rule, which was implying that biochemical changes in one neuron can stimulate neighboring synapses. So it's like, as I said, the neurons, it's a big network, all are interconnected. So if one neuron is firing up, it is going to activate the adjacent. The adjacent will activate the another. So it's going to pass on each other. So it's a dynamic passing of impulses. It's very rapid, it's very quick. It happens in the fraction of seconds. All right. Having said about the history, now slowly I'll try to take you to the neuroplasticity. What are the types of neuroplasticity? All right, to simplify, I would say neuroplasticity can be of two types. One is a structural neuroplasticity. It is also known as synaptic plasticity. The another is functional neuroplasticity. So as you can see, the name itself is telling you structural neuroplasticity means related to the structure of the nervous system or the neurons or the group of neurons. And the second is functional neuroplasticity. So structure means there is a changes happening in the brain structure. The changes are happening at the structure of the brain cells and the neurons. Even the number of receptors are increasing. The neurotransmitter level is going to increase. There are changes in the amount of gray matter, white matter density is going to change. So these are all actual structural changes what are happening in the brain or the neuronal cells. So that is known as structural neuroplasticity. Second type is known as functional neuroplasticity. So now when I talk about functional neuroplasticity, means it is related to the function of the brain cells. So when I say functions of the brain cells, I will give you an example rather to explain this. Suppose if the patient is having stroke or a brain injury and a part of neurons or a part of the brain is not working. So that neurons are not functioning properly. But now what happens if that patient is made to do movements, if that patient is made to do exercises or physiotherapy, the neurons, the damaged neurons, their neighboring neurons surrounding that damaged neurons, they will try to functionally adapt. They will take the charge of the damaged neurons. That is known as functional neuroplasticity. So it's not that the brain is damaged, so that part is gone. Okay, fine. It takes time to recover. But yes, the surrounding neurons will take over the charge. They try to adapt and they try to take over the function of that area, the damaged area. So that is the magic of neuroplasticity. All right, so that is known as functional neuroplasticity. So it refers to improved synaptic transmission and effectiveness due to synaptic plasticity, which depends on learning and memory. So again, the more you practice, the more faster, the more stronger networks will be formed. The more efficient transmission will happen. All right. So more you practice, the more you do movements, more and more precision, more and more fast conduction will happen in the brain, and that will also help to achieve the functional neuroplasticity. So during the learning process, there occurs improved effectiveness in the synaptic transmission and intracellular biochemical processes. So that's related to the overall functioning inside the neurons. And the first type, structure, is related to the structure of the neurons and the number of receptors, the level of neurotransmitters. So I hope this part is clear to everyone. So that is the two types of neuroplasticity, structure and function. Moving ahead. So as I mentioned, I just kept a small photograph for you to understand. So as you do some activity on the daily basis, your brain grows. So even if you talk about a normal child, so when the child is small, it tries to do some activities, but as they grow, their brain also develops. So the activity what they do, it creates the neuronal changes inside. The structure of the brain molds, it changes itself. That is structural plasticity. Functional plasticity is when the damaged area is there in the patient, as I said. So the damaged area is being taken over by the healthy neurons surrounding it, and they try to take the function of the damaged part. All right. So that is the image what it is talking about. So I think I should move ahead with the concept. I hope the concept is clear. The types of neuroplasticity. So now moving on to the neurobiological basis. All right. So now what actually happens? I already clearly mentioned that changes are happening, but what actually microscopic changes are happening? So as I said, the neurotransmitter levels are going to increase, the receptors are going to increase, even the receptor sites are going to increase. All right. Of course, if the neurotransmitters are increasing, if the receptors are equally increasing, then only they will be able to receive the signals and transmit it more and more. All right. Mind well, even the DNA and RNA regulatory factors, they are getting activated. There is even increase in protein synthesis, which is ultimately leading to the structural plasticity of the brain. There is something known as BDNF, that is brain-derived neurotrophic factor, which plays a very important role in neuronal survival and growth. It serves as a neurotransmitter modulator and it participates in neuronal plasticity. So this is the growth factor for the brain, which helps in survival of the neurons. It helps the neurons to grow. So even the BDNF level is going to increase. The patient is made to do exercises and when the activities are done. All right. So these are the, in short, the neurobiological changes happening in the brain.